Good evening and welcome. Cancer Council New South Wales acknowledges the traditional custodians, both past and present, of the lands on which we live and work. Tonight we will be talking about sex and sexuality. We will be providing you with some practical information and strategies about how to work towards getting your mojo back. Before we get started, I would like to take you through some housekeeping to make this event as seamless and interactive as possible. During the webinar, if you would like to ask the panel a question, please use the chat box located in the bottom left-hand corner of your screen. You can post comments, ask technical questions, or share information. To protect your privacy, you will not be able to see who is logged in tonight, but in the chat area you will see a first name and the initial of your surname. If you experience any difficulties hearing the sound via your computer, you can listen using your telephone. Dial the 1-800 number shown in the chat box there now and enter the passcode provided. We will also be launching some interactive polls throughout tonight's event. These are anonymous, so please feel free to participate. And during the last 15 minutes of the webinar, we will answer some of your questions addressing the most commonly raised themes. We had a lot of questions, so we're not going to be able to get to them all. So today's event will be recorded and you will be emailed a link to view the recording probably early next week. So if you get distracted by the chat box, you can watch the webinar again next week. And if at any stage you feel distressed, please contact a Lifeline counsellor on 13 11 14, which is available 24 hours a day. So let's get started. Firstly, I would like to introduce our panel. Pauline Shilkin. Give us a wave, Pauline. There she is. Dr. Catalina Lawson. And Dr. Amanda Horden. Hi, Amanda. I'm Jill Mills, and Annie Miller, Manager of the Practical Support Unit at Cancer Council, will be monitoring the live chat tonight, and you can say hello to her in the chat box. So let's get started. So just a few little facts about the subject we're going to be discussing tonight. Apparently over 40% of all cancer survivors experience negative sexual changes post-treatment. And this percentage increases dramatically to over 90% for those treated for cancers such as prostate, ovarian and cervical and other cancers experienced in that part of the body. So Cancer Council and Sydney Uni have identified that cancer survivors are suffering in silence and need support. New research has found that 50% of cancer survivors did not seek help for their sexual concerns, citing embarrassment, lack of privacy as the main barriers. The changes to your sexual well-being can leave you feeling less confident and less at ease with intimacy. Things such as fatigue, pain, physical discomfort, impotence and anxiety can greatly impact your sex life. And if it isn't dealt with, the problems can escalate, decreasing your self-esteem and affecting your intimate relationships. So we've got a quick polling question going to pop up. So just wondering, for you that have logged in so far, have you experienced any of these physical and or emotional responses? So please feel free to yes, no, or maybe some of them. I'm not sure how many people we've got logged on yet tonight, so okay. Apparently we've got just over 60 people logged on so far. That looks great. Thanks, guys. Okay, so now I would like to introduce you to Pauline Shilkin. So Pauline's going to talk a little bit about her story. I'm having trouble with the slides here tonight. So Pauline, if you read her bio, is a wellness coach, social worker, motivational speaker, and a 2-time breast cancer survivor. So over to you, Pauline.
This is my slide here, MHVD, LOL, and other unmentionables. This is my story that I'm going to tell tonight. Now, I'm aware that we all have very different stories in our cancer experiences, especially the fact that I'm not a man. So for some of you, there may not be the same way to relate to it. And I also am really conscious that I don't want people to feel at the end that they've had different experience, it's not been like it for them, or they've dealt with it, I've dealt with it better or worse, or anybody else. As we know, cancer is such a unique experience for all of us, and we all experience it differently. So I just really want to give a voice, I guess, to what's a really difficult subject, and I've learned to talk about lots of difficult subjects. Just briefly, my background, I was diagnosed first time with breast cancer when I was 33, and I had a partial mastectomy and radiotherapy. And I it didn't have much impact on my sexuality at that time. I had 2 small kids, so I wasn't getting a lot of sex in any case. So it really, and I had radiotherapy and I seemed to sail through it. I was clear for 15 years, and then just over 2.5 years ago, I was diagnosed again with a new primary in the same breast, and I opted to have a bilateral mastectomy with no reconstruction. It was not an easy decision for me, but I knew it was the right decision for me, and I really didn't have any concerns at that stage about the impact that it would have on my body. I was fairly comfortable with my body, and I knew that there was some symmetry that I was going to get having no breast. So I think that was important for me. I was surprised that it wasn't as difficult for me to get used to my new body. And I know not everybody finds that, but I had some amazing scars, and I have been known to flash it so people can see it. So I had the surgery, and then I had chemotherapy. And as you know, that I'm not going to go into the gory details of chemotherapy. And it's really interesting that I was surprised that I didn't have a bigger impact on myself with my surgery. I guess I was maybe lulled into a false sense of security that it'll all be okay, which is, I guess, because my experience the first time was the same. I didn't really have impact on my sexuality. So it's interesting also that while I was having chemo, I still actually had a reasonable sex drive, and we still actually had an active sex life. I was bald and titless, and somehow my partner still found me attractive, and I didn't seem to worry about it as much. And I say it was quite a surprise. Perhaps the fact that we didn't live in the same state and maybe made a difference. I was lucky, and I still felt really, really loved. But I guess there were moments at that time when I thought a nipple or a boob would be certainly enhance the whole experience for me. But on the whole, we actually managed okay. And then it all started to fall apart. So the first MH that the first thing on there is MH, and that's mental health. Now, I think a lot of people don't talk about mental health. And I think it's such a really important issue that that doesn't often get talked about in terms of impacting on your sexuality post-cancer treatment. It has an impact on your intimacy. It has an impact on your sex drive as well. I developed severe and almost debilitating anxiety around round 4 of chemo. I tried everything. I tried meditation. I tried tapping. If you know what tapping is, where you tap your head and hope everything will be okay. I tried diaphragmatic breathing. I tried mindfulness. I tried counselling. I tried exercise, and really none of it worked. And finally, I resorted to taking an antidepressant. And I know a lot of people don't talk about that. I wish people would talk about it more, because it has a huge impact on how I felt about myself, and then what the medication did. So the result was not only a reduction in my anxiety symptoms, but also my libido and the ability to have an orgasm, which is another side effect that the health professionals kind of forgot to mention to me. So then I had to weigh up what was more important, not being a dysfunctional neurotic mess outside of the bedroom or a tigress in the bedroom. I chose the mental stability. I'm still on that medication. It's made my life much easier, but it still has an impact on my sexuality. And when I talk about what else is coming up, the combination makes it really, really difficult. So that's the MH on my slide. The next slide is VD, not venereal disease, but vaginal dryness. Now, I know everybody just thinks it's easy to talk about. Well, it is, but it's not actually easy to live with. So I typed in vaginal dryness into Google, and these are some of the images I got. There's a little wrinkled pussy. The other one has a t-shirt that says, I suffer from vaginal dryness and itching. My vagina supply is dried up, and I'm itching for some more. I was stunned and gobsmacked that would still appear on a t-shirt. The next one was a dry, shrivel up flower, and the other one, I'm not sure what that was, but I sort of looked at it and thought, love hearts, I'm not sure. So there's a lot of stuff around it. Nobody really talks about it, although they do talk about it, but sort of in hushed tones and not really in the truth about what happened. So what a shock it was that my lack of breasts were not going to be the cause of my change of my sex life after treatment. I did do a bit of lurking on one of the breast cancer online forums, and what really surprised me was there's a lot of talk about women, losing their sense of intimacy. And I was a little bit smug going, well, that's not really going to happen to me. I was okay the first time. I'm okay without my boobs and everything like that, blah, 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 very smug. And it wasn't really until I started on the Aromacin that I started to have the vaginal dryness. And it's just often it's used as a throwaway line. Oh, by the way, the medication causes vaginal dryness. But I had no idea what that just meant. And it was such a shock for me that I felt that my vagina had let me down, as opposed to, I guess, the rest of my body, or my changed body image through my treatment. And suddenly intercourse hurt, and our sex life was really derailed. And it was such a shock for me. And I really, if I'm going to talk about tips for health professionals, we really need more information about it. I was a well-educated, I speak cancer language, or cancer speak was my first language because I'd worked in the area, worked in support. But I said it before, I kind of missed the memo on just what that was going to do, and I just didn't get it, or how the medication would affect me. Look, I was lucky that I had a GP who referred me to a physiotherapist who specialised in that. But it would have been really helpful, I think, if somebody could have given me a little care package when they diagnosed me or gave me the medication. And maybe I'll talk about that a bit at the end, about some of my tips that I think we should give. So that was vaginal dryness, and I know a lot of women suffer from it. It doesn't get talked about, and it's just, it messes with everything. And as I said, I really feel that that's what I miss the most in terms of feeling let down about my experience. And then the next LOL, which is not laughing out loud, but loss of libido. So as we know, our libido can get affected by all sorts of things. So I've got the double whammy. I'm on Aromacin, I'm also on Lexapro. I'm also postmenopausal, and so I think all of those impact. But it was also a really shock to me. I had a really active sex life. I had a really high libido, and suddenly it sort of, everything was, I guess, turned down and turned off. And I didn't really expect it to have that impact. I know that, as we get older, as my partner said, as we get older, he said to me, one of us is going to end up having an issue with our sexuality, or something's going to impact on our sex life. But for me, old was 80, not 51. And I guess I've struggled with that quite a lot. But I use lubricant is a big thing of my life, and I think that's really important to talk about. I'm really blessed that I have a really understanding partner. But I do feel guilty that things have changed from us, that it's not the same, and that I do end up, I guess sometimes I avoid it, which is not a good thing to do. So it is those three things for me: issues of mental health, the vaginal dryness, and the loss of libido have always combined to have changed. But I'm coping with it, I'm managing with it. It's different. And I have to say, a lot of people talk about intimacy, and that's great. The intimacy is, I do have intimacy, but sometimes the spontaneity would be a really good thing to have. I mean, I found some things that work for me, and I know everybody will find some things that work with them. And I remember when I went to buy somebody said I should get some Replens, and I went to buy the Replens, and I was horrified because on the jar, on the packaging, it's got for vaginal atrophy, and I was mortified. I really wish somebody would use some. It's about language. It's all about language. We talk a lot about language in cancer survivorship, but some of those things are really, I'm a young woman, to walk in and think about what's happened to me as atrophied was quite, I found that quite confronting. In fact, I didn't even want to buy the product. I have bought it since, and I found it very, very useful. So the interesting thing is, my partner tells me, and I'm very lucky, he says to me that the most important part about me is what's between now I'm probably not going to say what everybody else thinks is, but what he says is between my ears. And I know, I'm very blessed, I'm very lucky that it is, and it is. We do know that, our brains are our biggest sex organ. A lot of sex is in your head. But also when everything else is going on, you get a wandering mind, and it's learning about staying in the moment. So it's been a really interesting journey for me, from thinking that it was losing my breast and having a bilateral mastectomy that was going to be the biggest impact on my sexuality. But it was the surprise of the side effects of the treatment that I'm now, those of us on it know have to use for a long time, and not really understanding or not really being prepared for what that actually meant. and I think that lack of education was really difficult. So to finish off, I don't have the answers. I've struggled probably like everybody. I'm very blessed, as I said, I have a really great partner. We still are intimate, and if I say to people, try and have intimacy where you know we're near the bedroom. Kiss where you feel fully clothed and don't feel pressure to do anything else. I think that's often the thing. I found it really challenging. And the other thing is I think it's really easy to get complacent, and that's probably been my biggest issue about not necessarily trying things that might make it easier for me. But I really think we need to find what works for us, and I think we really need to change the language around how we talk about it, being more clear about the actual impact so that we can be prepared for it. It doesn't come as such a rude shock as it did for me. And I hope by talking about it, I can give people a voice. And I'm prepared to talk about it anywhere. Please stay tuned. There may be a stand-up comedy routine coming around because I think it's really, really important. And I guess the final thing is it's easy to be flippant. But I really do believe that we need to learn about some self-compassion to ourselves. And it's really important. We need to be kind to ourselves and know that the common humanity is we're not alone in our thoughts and feelings, that other people are experiencing it. So that's my story. There's some good, there's some bad, there's some ugly, there's some downright good sex still happening somewhere along there. And it's a matter of it's a journey and a learning. Oh, I don't like that word. Why did I use journey? It's just an experience. But I really think for health professionals, it's something that needs to be much more open. And I, as I said, I was smug the fact that losing my breath wasn't going to impact on me until a little bit down the track. So look, that's my story. I hope people can respond to it. And the fact that I can't see your faces makes it a little bit easier that I've just talked intimately about my sex life to however many people. Thanks for the opportunity and thank you, and I look forward to the rest of the presentation.
Thanks, Pauline. Now we'll move on to the polling question. So, can you relate to Pauline's story? Yes, no, some of it. It might be a bit difficult for some of the men to relate to, but we will be talking about some men's issues during the webinar, so please don't feel left out, men. That looks great. Thank you, everybody. So moving right along, I'd like to introduce Dr. Catalina Lawson, who's a senior lecturer in clinical psychology at the University of Sydney and the lead researcher in the Rekindle study. So welcome, Catalina.
Thanks, Jill, for having me, and thank you so much, Pauline, for sharing your story again. Guys, I've had the honor of having Pauline as one of our ambassadors for the study I'll talk to you about today, and it's just really been quite an inspiration and really, truly an honor to actually just have her have entered my life. So today, all of us are here to talk about sex after cancer, and really how does this new normal actually change and how we can adapt sexual well-being accordingly. So I am going to really ask you now to just take a step back. Most of you guys are going to be on your own, hopefully somewhere private. And I want you to start, maybe close your eyes and think about sexuality and what that means to you when you hear that word, sexuality. I have some images of holding hands and being close with somebody that you love and just laughing. Sexuality is how we walk into a room, how we smile, and certainly there's definitely just some sexiness about it. But the one thing sexuality is not just sex. So when we're talking about sexuality, and certainly from Pauline's story, we're talking about everything about us. Our values, how we assert our sexuality, how we talk about it, how we perceive our own sexuality, our body image, and how we connect with others. So when we're talking about sexual changes after cancer, we're not just talking about some of those physical changes, which we'll definitely talk about today, but we're talking about all of those aspects about our sexuality that can affect your sexual well-being. So we started off with a few facts that Jill mentioned, and a lot of people, it is not at all surprising that a lot of people don't know about how prevalent some of these sexual concerns are after cancer. Most cancer patients experience some type of sexual change, whether that be physical or emotional. And particularly when you're talking about some of those below-the-belt survivors, gynae cancers, prostate, testicular cancers, that's really where we're seeing the prevalence of physical dysfunction and physical changes as well as emotional changes really increasing. But one thing to keep in mind when we're talking about a lot of these sexual changes is that these sexual changes are pretty complex. A lot of things are happening at the same time. So if you think about that slide that I showed as far as how sexuality encompasses all of these aspects about ourselves, you can imagine that if somebody, for instance, is experiencing pain during or before or during intercourse, if that same person is experiencing anxiety, that anxiety can actually make that pain worse. When we feel anxious or stressed, we tend to tighten up and become a bit more frigid and not necessarily more relaxed. So then what ends up happening is that that person likely will experience more pain, and then that pain is exacerbated and the problem is compounded. So that's a really clear example of how both the psychological and the physical problems can compound one another and interact to make this problem, when not managed early, quite a big obstacle long term. So that's really important to keep in mind, because when we talk about some of these sexual changes, we really try to hit one bullet, and oftentimes it's not going to just be one. So we know that unlike some of the other side effects after cancer, unfortunately, a lot of these sexual changes tend to linger well beyond 2 years after treatment. But we do know that there's lots of strategies, and Amanda's going to talk about a lot of those, that survivors can use to really improve sexual functioning. So there's a lot of hope. Just to really quickly go through some of the physical changes. We'll go first through what some females experience and then what some males experience. Pauline certainly expressed her experience with vaginal dryness and tightness. And regarding sexual concerns, this is one of the most reported problems. Interestingly, people are reporting this, but as Pauline said, that dialogue and that conversation with physicians isn't really happening. So certainly a lot of symptoms related to early menopause, problems associated with surgery, removal of a body part, and that's not just necessarily pain at the site, but also changes to body image, femininity, masculinity, and certainly that also is going to influence individuals' desire as well as motivation to engage in sexual activity, pain during penetration, and again, as Pauline shared, changes to orgasms where they either aren't happening at all, or if they are happening, they're not nearly as intense. These are all changes, and particularly the vaginal dryness, that are often not talked about. When we're talking about vaginal dryness, we've had some of our survivors tell us that this is not just about sex. It actually would hurt them to walk and to not even be able to do their daily activities. For the men, certainly one of the most prominent and reported as far as one of their main sexual concerns is difficulty achieving and maintaining an erection. Certainly this can be incredibly frustrating for the man as well as their partner. And again, when we're thinking about that dynamic process, it can be really hard for men to manage and adapt to this. And so oftentimes you'll see men trying different strategies and then those strategies not working and them stopping and avoiding. Difficulty reaching climax, dry ejaculate is something that shocks a lot of men, particularly after prostate cancer treatment, and certainly incontinence during sex. This happens as well as with women, and you can imagine that feelings of embarrassment, shame, all of those types of things are going to discourage men from engaging in sexual activities. So what you can see is that a lot of these physical changes, as well as emotional, anxiety, depression, they can affect various parts of the sexual response cycle. So affecting our desire, our arousal, how we have our orgasms, as well as after the resolution of sex. So as you can imagine, as more things are affected, the worse their satisfaction might be. So one thing that often hasn't really been mentioned much is partners. And unfortunately, partners often get the shaft. They really don't get acknowledged very much, and their needs don't really get addressed. But we're finding previous research has shown that partners experience as much, if not more, changes to sexual frequency as feelings of intimacy. And oftentimes these changes are associated when the patient themselves are experiencing more physical impairments, but also partners experience fatigue associated with their caregiving. And of course, that you can imagine that would actually lower their libido and their interest in sex. And certainly partners witness the patient going through such an intimate and life-threatening experience that their perceptions may change, not from being a lover to then becoming more of the patient and them as the carer. So you see that these dynamics are happening, and the end result ends up being that partners report decreased sexual activity and satisfaction, but also feelings of self-blame and sadness. Again, these conversations aren't had, and so you see patients and their partners sitting in silence. But there is hope. So we know that there's a lot of things that we can do to try to improve sexual functioning and sexual well-being. And we know that it's important to facilitate communication amongst couples and amongst individuals when they're first starting new relationships. So for individuals who are single, there's strategies to try and treat the underlying cause where possible, whether that be physical, psychological, or social. And really minimizing some of these side effects that we've talked about and providing some symptom relief. We'll talk to you about that. And also providing information and advice as far as alternative strategies showing intimacy. And of course, there are specialty services that we can refer to when needed. So I'm actually going to pass this on now to Dr. Amanda Horton, who will talk to you guys a little bit more about some of these strategies.
Thanks, Catalina. I'm sitting there actually applauding everything that you say. It's so wonderful to be surrounded by like-minded people who recognise and value the importance of sexual health and well-being. And thank you also to Pauline for her beautiful story. Exactly, I'm just picking up exactly where Catalina just left off then with a wonderful study that was also Australian, and it was conducted in the last 5 years or so by a great group, Professor Jane Usher, Emily Gilbert and Jeanette Pert. Actually explored the needs of carers in relation to sexual health and well-being, and it was a beautiful study because there were 300 people involved. 2/3 of them were women and 1/3 were men, and that was exceptional research in itself. And exactly as Pauline and Catalina have been saying up until now, there was dramatic changes in people's intimate and sexual expression in every single of the 300 people that were involved. But the thing I really liked about this study was it appeared the layers just that little bit more, because within that study they found out that 16% of the people within the study had actually what they called sexually renegotiated, and what that meant for this group of researchers was that those people, those partners, those people who were intimately involved in the cancer experience were actually able to move and feel closer after the cancer experience, irrespective of the fact that they actually had and changes to their sexual health and intimacy expressions. And so what I want to really do is just come in at that study where how did they do that was the big question, and what do they mean by sexual renegotiation? And it's exactly as you can see here, that they actually said that people, just what Pauline and Catalina have been saying, they invested in communication, they actually made an effort, and they actually worked on what was going on for them as individuals and focused on the deep connection and non-penetration sort of levels of intimacy. And so we're going to talk about some of those ways today. We're going to explore the fun and the opportunity that can sometimes arise here to perhaps re-navigate or redirect old pathways of sexual exploration and expression, and to work out, well, now in this change situation, how can we cement and how can we actually forge that closeness again? So we'll briefly touch on some of the strategies that actually these wonderful researchers started as well. And just as Catalina said so beautifully, you know, it all really begins with what do these words mean for me? And if you're sitting there as a health professional and wanting to be able to engage better with the patients in your care, it's exactly the same for us as health professionals. What do sexuality mean to us? What does intimacy? How does what I feel in myself shape how I connect and express myself to my partner? And how might this as a health professional, the way that I see my own sexuality, how might the way that I define sexuality and intimacy in my family, my culture, my clinical practice, and how might all of that then start to shape the way that I communicate with the patients in my care? So one of the ways that I actually find is that going that step further and just going, well, what are my greatest challenges and why might that be so? And so exactly like Catalina was said, closing the eyes and actually exploring just that whole concept of the barriers that we put into place as health professionals and the obstacles that actually can just jump in front of us, just like Pauline said there. And Pauline just spoke there about the wandering mind, and I often talk about the negative thought viruses, which will come back. And also being aware that there are quite a few health professionals on this webinar as well. It's actually from the whole upbringing that I was actually not allowed to go to sex education when I was in primary school. I was forbidden from it, and I that I'm making up for lost time now, and now just saying that, you know, for stepping aside from the nice girl or the nice boy and what will people think of me if I validate and raise this as an important topic. And also as health professionals, just we can't always get it right the first time. That's probably the most important thing that patients in our care are asking us to do. People affected by cancer are saying, just make it okay to raise the topic, and then we can start that communication process. So perhaps the most important things that in my clinical practice now, when I am very humbled and very privileged to work with people who share sexual scenarios and instances and issues as a result of disease, as a result of chronic illness, as a result of cancer. And often, as you would really relate to, I'm sure, is that we come with a great big shopping list of all the things that are going wrong, all the negative thoughts, the obstacles, the dry vagina, the problems with the erection, the partners who are moving away from us, the partner, not feeling so good about ourselves. And I often say to people with great respect and compassion, I listen to that, I get the whole shopping list of what that sounds like, what that experience is like for the person, and then I literally symbolic then actually start to actually think then, well, how can we actually how can we move on to what do you really want? What is it that, how will you know that you're starting to feel that libido rise? What will you be thinking? What will you be feeling? How will you know that you have it? Especially when we're saying over and over again in this webinar that sexuality and intimacy isn't just about whether you're penetrating, whether you're having an orgasm. It's about that very deep connection that happens between two people that are very connected on a sexual level, or just within yourself as an individual. So some of the really helpful questions I could think now, just reflecting, what is it that I would want? And I remember talking to a wonderful woman who was very young. She was only 29 when she was diagnosed with breast cancer. And one of her answers to this question, she was single, and she came to me because she wanted to feel a better self-confidence, a better self-esteem. And her answer to this question was, you know what, I'm going to be cooking one day in the kitchen and I'm going to be listening to my favourite music, and I'm just going to notice that my hips start to move in a sensual, intimate way. And that's how I'll know that it's starting to come back. On that, knowing that from that point on, what would be the next step and what would the next step be, and what would that allow her to do, and what would that give her in opening her self to the possibility of a new relationship as well. So a lot of what Pauline touched on and Catalina as well is that we can often, the thing that Pauline said, the thing between her two ears, that wonderful mind that each of us in this webinar actually has there, can sometimes get in our way of where we really be and where we're heading as well. And I love the whole notion that the term fear often stands for false expectation appears real. So often the fears that I hear in my clinical practice are people will say to me, oh, he won't like me, or she's not attracted, or he won't even get in the car with me now, or I'm just being pushed off to the clinic, and sex is definitely not on the agenda. And sometimes the fears are very real and legitimate, and we can work with those as well. And sometimes sometimes those fears are the worries that happen deep within us as well. So exactly as Pauline said, with the wandering mind and the communication importance, that part of what we need to do is start to work out what's going on for us as people experiencing changes to sexual health and well-being, and then to start thinking, what do we want? How will we know we've got it? And to actually start putting into practice some of the very first steps in order to get to where you want to go. And I often say to people, in a compassionate, a very genuine way, you're not going to be marked on it. And it's the same to us as health professionals, that when we start to open the conversation and ask somebody for the first time perhaps, and how has all this treatment impacted the way that you feel about yourself as a man or a woman? Or what, where is it that you want to go in this experience of expressing your sexuality? And so, sometimes we feel that it doesn't go as well as we want, but we actually know that it's very good and people appreciate when we can start to open that dialogue as well. Sex on the agenda is often working with the mind, finding out, well, how will I know? How will I know? What will I feel? What will I experience? What will the thoughts be? What will the sensations be in my body as well? And part of the basic homework, the foundations to this, is actually just making it okay to put sexuality and intimacy as a priority. And perhaps one of the biggest things that I hear from people is that when you're affected or being impacted by a cancer experience, that you're often consumed by appointments, by people dropping in, by needing to respond and say thank yous for the kind gestures that people are often offering. And often then just sexuality and intimacy becomes just a lower priority in the day, often the last thing on the list, and with the exhaustion it's often hard to find that time. So actually factoring it in, maybe even scheduling it in the diary, just even to have whatever it is that you want. Is it a soak in the bath and listening to beautiful sensual music? Is it exploring and moving to the new body and actually getting acquainted with that, which we'll talk about in a moment? Is it there? Is it actually holding hands? Is it saying beautiful romantic things to each other? And so once again, there, when the focus isn't just on penetration, it's also on sensual and intimate expression. The goal is for pleasure rather than in performance. So what we said before, and we're saying it over and over again, is just being aware, even taking the lighting candles, setting the scene, and just taking a few really deep breaths and just thinking to yourself and feeling the body in that place, feeling the body in the chair or the bath, feeling the body in the bed, and actually just starting to get really comfortable with some physical scars and changes that you're experiencing at the time. And very soon Catalina's going to share with you it's a wonderful resource that I'm so excited that we've all got access to now. And it will be actually explaining things that are called state focus, where we actually will, through this research that Catalina is the chief investigator for, there's going to be practical strategies on actually how to start to close the eyes and start to feel the body and start to even stroke parts of the body and just start to explore parts of the body that are going to be aroused or sensually stimulated. And as many women have said to me, particularly same-sex women in loving lesbian relationships and who are a lot older and post-menopausal, they've often said to me that things aren't the same with an orgasm now in the vaginal area, but when they start to move their awareness to different parts of the body, they're actually pleasantly surprised at how arousing that other parts of their body can be. And it's just the same with wonderful men that I often meet who say to me, look, I haven't got an erection, I don't have the energy, I've tried the sex pumps and things that I'm about to give you information on. But, often I say to men, you've still got 10 fingers and you've still got a tongue, and just allowing yourself to have the opportunity and the opportunity and the possibility of exploring sensual reaction in terms of oral sex and sensual massage oils, and perhaps even going into the mind and trying fantasies and vibrators, building that awareness and just allowing your body and your mind to take you to places exactly that you may not have explored before. So Catalina is going to mention this beautiful video that's going to be available to you if you can in the Rekindle study. So I'll come back to that as well. But it's saying that I've even had the privilege of working with people with spinal cord compression who actually can't feel their body from the waist down, and yet they still manage to feel aroused in the mind. And there's been amazing studies done where people can have full-blown orgasms under an MRI. Can you just imagine it? And they're actually not even touching themselves. They're starting to evoke sensual fantasies. They're starting to recall times of erotic moments in life or in their fantasy, and they can evoke an erotic response or a full-blown orgasm under an MRI. So it's fascinating just how much power we do have in the mind as well. So just moving to a very important topic, which is lubrication, and I think you'll be the hit at your next dinner party or your next social gathering, because it's really, we've heard it from Catalina, we've heard it from Pauline, and some of you in the chat room are talking about the importance of lubrication. And I would just want to formulate the strategy that there's a difference between lubrication, there's a difference between vaginal moistures, and then topical estrogen cream. And I'm just going to very gently and very quickly, and we can talk about this in the panel a bit later if you want more information on it. So lubrication can be a very empowering experience, and just like Pauline and Catalina said, that dry vaginas aren't just about opening yourself to the possibility of penetration. For many people, it's about physical comfort, sitting in a pair of jeans, driving in a car. So there's a beautiful lubrication around here, Pure, which is a silicone or a water-based, and you can see that just to the left, just to the right of the screen there. And it's a beautiful one because just with saliva it can be reactivated, and it can actually then be quite a potent lubrication which can last and last. So you can put it on, it's very silky. Like one lady said to me, oh, it's just like putting on silk stockings rather than those old nylon pantyhose. Somebody in the chat room mentioned, you know, the dreaded KY jelly that I with in the olden days. And there are things that are just so much more refined now. There's also a beautiful silk. There's a beautiful silk there which is made of kiwi fruit, and I always say that it's 99% kiwi fruit, but you know, there's no pips in it. It's Australian product. And there's a lovely liquid which is vegan friendly. And I just mentioned the olive oil there because there have been a few studies there that actually have talked about olive oil, and some health professionals mention that. And a lot of people say I put olive oil on my head, I put olive oil on my skin, I put olive oil on my erections and my vaginas. And there has been a little bit of study, but I personally just put olive oil on the pizza base and I leave the other ones to you. There's vaginal moisturisers, which aren't just really a lubricant. They draw fluid into the vagina and they make it more comfortable and a little bit more, they puffier, but nothing, when your vagina is drying, nothing will actually puff it up in a way that estrogen will. So there was a very small study which looked at putting vaginal moisturisers onto vaginas of women with breast cancer. And then it was in a controlled study where they were also, one of the other group was given topical estrogen cream to actually physically build up the vaginal tissue. And interestingly, the consumers of this very small study actually voted the vaginal moisturiser as easier to deal with as well. So we can talk about that in the panel as well. And that's a big topic, the whole vaginal estrogen cream for people who have cancers that may be sensitive to hormones. But it's really, really important there to look at the fact that hormones, that vaginal moisturisers and lubrications that I've met don't have hormones. And just very briefly, there are a lot of erectile aids there which can assist with the mind work that we encourage you to do. And I'd like to talk about some of those in the panel discussion as well. So some of the tablets, the injections and the pellets. And just Rekindle that Catalina will talk about, it's got a fantastic way where you can actually weigh up the pros and cons of using part of the equipment and actually then focusing on what's best for you. So just coming to the end of my segment, where one of the biggest things I think is about accepting yourself, and as Pauline so beautifully said, just giving yourself permission to love your body and pay respect and honour it, even though part of you can sometimes feel that it's let you down and that it's still lagging behind where you want it to be. Building a very strong support system and just knowing that it takes practice and time, and whether you think you can or you can't, you're right. And perhaps one of the biggest things, the messages I want to impart, is that a lot of it begins with what it is that you're going for, what it is, and working on the wonderful mind of yours to bring that to fruition. So I'm just going to pass the banner back to Catalina now and look forward to speaking to you in the panel discussion. Thank you.
Thank you so much, Amanda. Definitely, I hope everybody has got just a pretty decent foundation as far as understanding that there are strategies out there that you can learn more about. But unfortunately, there is a major gap between who actually needs this support and who actually ends up getting it. So we know, as I said before, we know that these things work, but unfortunately most people, if you hadn't heard about a lot of these things, you are not alone. oftentimes patients and partners aren't told about these things because doctors aren't telling them. We're not spreading the word. We don't have these conversations. So people aren't told about that they can actually do something to manage these side effects. One of the biggest barriers to getting the help you need is embarrassment. And this is really on both the patient's and on the provider's side. You get silence. Patients are not sure if they want to talk to, particularly their oncologist, about sexual concerns because this is the person who just saved their life. And providers, quite honestly, they just really, who wants to talk about sex? I love talking about sex, but not everybody does. So you see embarrassment on both sides, and what you end up with is silence. Silence may be romantic sometimes in the bedroom, but it doesn't really help get you there. So oftentimes people, a lot of these strategies that we've talked about, what you find is when we're talking particularly about sexual intercourse and activity, it's very much a dyadic process. And I've seen that, and we'll address I was writing somebody's questions there, but really oftentimes our interventions, our treatments don't engage both of the partners or only focus on one. And oftentimes partners are just really not acknowledged. So what we've tried to do is find out a little bit more about how we can reduce that gap. So in building Rekindle, we did an assessment throughout Australia, primarily with breast cancer survivors, to find out exactly what is it, how can we design some type of resource to get you the help you need. So we sent an email out to a bunch of people and had a great response. And basically what we found out was that not many people of our survivors, most of these women reported sexual dysfunction as well as sexual dissatisfaction. Yet, most of them did not get help. As you can see, most of the help that they did was on their own. They're reading things, they're looking online, but they are not talking to their doctor, and they're certainly not talking to their oncologist. So we asked them also what they've done. So if you are women, or these women are using lubricants, vibrators, interestingly enough, they're really not going to therapy to address some of these sexual concerns, which you would think that's where people would go to talk. Of course, you'd go talk with a counselor. But this is not the first study that shows that people are not going to individual counseling because, again, it takes a lot to get to that stage and to actually talk about these things. So if you haven't, don't worry, you're not alone in doing that. And the ones who did, not many of them found it helpful. And I'm a psychologist. Okay, so we also asked them what would they'd like to be addressed. And certainly, like what's been echoed in this previously in this seminar, is really wanting to learn a little bit more about why some of these changes are happening and what you can do to manage it. As far as how survivors would like to have a resource. Luckily, and I'm happy that this is actually on the web-based formats were the most popular. And not surprisingly, at least face-to-face formats, particularly in a group setting, really is the least preferred, particularly, again, considering any types of embarrassment and issues of privacy. So based on all of this, they also wanted some videos. Based on this, we decided to begin to develop Rekindle. We applied for funding and got support to develop a web-based resource. And so we wanted to find out a little bit more about how we need to design this resource so that we can really particularly engage men. And we know that men are a little bit harder to engage in these types of treatments, but engage them, but also retain them. So we did a lot of qualitative interviews as well, and it's really important for treatments to get to the point and to be very tailored. So, and really to highlight communication skills. So really that's what we tried to do. We developed Rekindle. We did some usability testing, bringing some consumers in, and basically ignore some of these numbers and the somewhat decent graph. But basically it proved usable, user-friendly. So myself and Annie Miller and a whole host of multidisciplinary clinicians and researchers, we all got together and have built Rekindle. So Rekindle is a web-based resource that is designed to address sexual concerns of all cancer survivors, both men, women, people who are single or in relationships, as well as individuals who are having sex with opposite or same-sex partners. There is 12 versions of Rekindle, and we're really proud because we are trying to basically get help to those who need it. And with technology and the fact that we're able to talk to people in New Zealand and all over, with this technology, we have the access, the possibility to have really broad reach with a lot of individualized treatments. So Rekindle has 12 versions, but it's also going to be very tailored to specifically what users want. And we know that that's really important. As Pauline started to say at the beginning, not everybody has the same experience. And certainly everyone's, particularly when talking about sexuality, is incredibly unique. So Rekindle will ask a lot of questions at the beginning to try to individualize your own Rekindle pathway. So at the heart of Rekindle is the fact that it includes video testimonials from patients, survivors, and partners who have experienced sexual concerns. And Pauline was so gracious to share her story. And now I'd like to share one of our other partners, one of our other survivors, Glenn, and just give you guys a quick little segment to see what is involved in Rekindle and his experience.
Well, the initial thing, of course, is that I didn't feel that I was satisfying her, obviously the same way as I had before. So therefore we had to start exploring. And I think it was a matter of just getting on the internet and having a look at what was available, what kind of things could be had. And I got her involved and came up with a couple of things, tried them, and the interest has now increased. Basically, vibrators were one of the main ones, some lubricant components for her, and I think also we've come to agreement that actually coming together is probably not possible these days. I can't stimulate her to that extreme, but we do get together and we enjoy things, so it's good.
All right, so that was Glenn, and that's when, if you choose to use Rekindle and see what this is about, the idea behind meeting other individuals who've experienced some of these changes is first and foremost, we hope, so that individuals out there do not feel alone. Unfortunately, like we have said throughout, a lot of these concerns are pretty common, and we hope to empower users by having these testimonials. We also brought multidisciplinary healthcare providers out to explain why some of these problems are happening. So Fran Boyle, a medical oncologist, Sandra Turner, a radiation oncologist, Michael Lowy, Kim Hobbs, physiotherapist. We basically are giving users the medical answers as well to understand what's the background of a lot of these sexual concerns. Then also within Rekindle, at the heart of what Amanda was talking about, is we're really teaching a lot of communication skills. So we're going to teach you ineffective as well as effective communication skills. And this is not just to make yourself more assertive generally, because that'll be the first part, but it is actually specifically learning also how to talk about have these really difficult conversations. And so again, and that's tailored for your sexual orientation, as well as whether you're single or you're partnered. We have lots of games, to try and burst the bubbles of the different myths out there, and also teaching people how to better read faces. So Rekindle, all in all, is trying to be highly interactive and touch on all of those things that we've been talking about tonight to not only teach you new skills and how to better manage some of these side effects, but for you or your partner to feel a bit more empowered, that you can actually take control of your sex life and your sexual well-being. We have lots of questions that you may find helpful to ask your clinicians. So basically, Rekindle is is a web-based resource that anybody can access from anywhere in the world at any time, 24/7. You can log on to rekindleonline.org.au. And I'm going to wrap it up here so we can get to everybody's questions. Thanks a lot.
Thank you, Catalina. And we'll go along to the polling question. Do you think that you could implement any of Catalina's or Amanda's recommendations? We'll do a quick poll. We're running out of time. But as I said, we probably will go over time a little bit because we've got quite a few questions to get through. Many we won't get to, but we sort of look at the different themes and try and address them as well we can. So thank you, everybody. And we'll move on now to the questions. So the first question, so what I'll do is I'll read the questions out. We're all going to be on camera, and I'm not sure whether Amanda or Catalina are going to answer the first question, who's going to have a go at it, but I'll read it out. So I used to seduce my wife, now I have erectile dysfunction and she won't seduce me. She doesn't like me to touch her and hates to touch me. What should I do? So who would like to address that one? Catalina?
Well, I was actually, because that came on the chat, and I was actually trying to, I'm a slow typer, sorry. I was trying to make a response because I think someone else had asked a similar question. First and foremost, I'm really sorry to hear that this has been happening. I can imagine how frustrating it is. But oftentimes when there is this change of you being the aggressor and your partner not responding or vice versa, or not feeling like they're seducing you enough, generally what we find is that this is not necessarily all about the function, but really about the underlying changes in the relationship. So I can't stress enough how important it is to communicate. But I also do not minimize how hard that can be. So one of the things I would recommend first off is really to start learning, figuring out for yourself what it is you actually want. What are you wanting, not just necessarily to be seduced or for your partner to react when you're seducing them, but what's that underlying need and how can you actually try to assert that? But also how can you better understand where your partner is at? And really trying to have some of those communication. Have that conversation. Amanda, would you kind of agree with that?
Oh, I totally agree with you. Yeah, couldn't have said it better.
Thanks.
You got nothing to add then, Amanda?
I'm looking at all the other questions going, oh my God, it's 7:59.
No, that's okay. We can go over as long as everyone's happy to stay tuned in, 5, 10, 15 minutes. So it will be fine. So the second question, again, I'll read it out. Do you have any advice for a cancer patient suffering from early menopause? All the things we've been talking about, low libido, low self-esteem, hot flushes, weight gain, etc., brought on by treatment. So, Amanda, maybe if you'd like to have a go.
Well, once again, I think it's experiencing an early or a treatment-induced menopause can be very, very, very challenging, and it's very hard just to, like Catalina said in her presentation, just to give one bullet for all the answers. So the way that I would approach this is to ask you, which would be the most important area for you to work on first. And often, low self-esteem is the umbrella for then not having much desire as well, and hot flushes. So yeah, working out what it is that you want to deal with first, and then finding the right resources, which we're going to come back to as well, for each area. So hot flushes, there are some good clinical practice guidelines available to clinicians out there in the field, and sometimes if you're in contact with a GP, they may not always be aware of them. So just being aware that there are some very evidence-based, very sound approaches to managing hot flushes, and weight gain we talked about before as well, about moving the body and moving the mind and getting motivated as well. But probably the biggest thing I think is a really hard challenge is actually just getting in the mood when feeling fatigued and perhaps not feeling as good about yourself as well. So it's pretty much reinforcing all the things that we said before about just working out what that would make you feel just more, more satisfied, having a go yourself. So there's some beautiful activities on Rekindle about just taking some time alone and not even with a partner, and then incorporating a partner if you have one, to just explore just how the new body's feeling and the changes we're experiencing. I could go on and on and on, but there's just so many layers dealing with what it is you want, the mind, accessing the right kind of resources, and peer support is something that we haven't really mentioned here, but just linking in through the cancer helpline available in each state, just about the fantastic power of connecting with people who have been through a similar situation, and we can see a lot of that happening in our screen on the left-hand corner as well. Often people through peer support have taught me some of the strategies that then I go and share with patients, so I think we can't underestimate the power of that as well.
Sure, if I can just pop in just with the weight gain. It's interesting, and I think often a lot of cancer survivors are expected to feel grateful for everything, because the fact that they're alive and shouldn't complain. And sometimes I think for women that weight gain can be a really, really big issue. And I gained some weight on my medication, and I found it actually quite difficult, my changing body. I mean, I know also I'm through menopause, so I go, okay, my body was going to change, but it is just one of the things, and a lot of people don't feel that they can raise that because there's an expectation, well, really, you're alive, so you shouldn't, what's a few extra kilos? But it can actually have an impact, and sometimes we're not given permission to whinge about it.
Yeah, okay, that's fair enough comment. Thanks, Pauline. Okay, so we'll move on to the next question. So due to the physical discomfort of the act, I'm not so keen and now have sex for my husband, not for myself. How do you overcome the reluctance to participate without making your partner feel uncared for or guilty for his needs? So Catalina's nodding away there. Would you like to say something, Catalina?
No, again, unfortunately, this is something that some of our survivors have talked about, and certainly in Rekindle they talk about, as far as really feeling bad, that tension between feeling bad for their partner and knowing that they have needs and wanting to give that, but really not being interested. And certainly, Pauline, maybe you certainly want to share about this too. Again, I really think that this comes down to learning how to compromise and how to looking for alternative ways as a couple to actually try to approach this. What often happens is that it's never addressed, and so one person who's actually engaging in this and doing what they don't want starts building up resentment. And then again, when we talk about some of these physical changes or anxiety or distress, that's going to get worse too. So, by not addressing this and trying to keep going on and on, I'm all about fake it till you make it for a little bit, but sometimes when you fake it for too long, you're just really not sure what you're faking for anymore. So it's, I really recommend, again, here, trying to open up that conversation. And first and foremost, figuring out what you feel comfortable with. Do that before you actually, try to have that conversation. But Pauline, did you want to add to that a little bit?
I guess it's just one way of staying connected and showing that you care about your patient. And this might be a really weird analogy, but sometimes I don't always feel like cooking dinner every night for my partner. But I do that because it's part of an expression of my caring for him. And sometimes it's 3-course amazing meal, and sometimes it's toasted cheese sandwiches. And I think sometimes that there is a bit of that expectation, and just really, it's often hard, but maybe just if you look at it, it's just one other way of showing your care and that your fear that he's not necessarily enjoying it. But from my experience, my partner, even if I'm not 100% into it, he enjoys it because he enjoys me being next to him. And I think sometimes it's better than him doing it by himself. And I think that, it's like, yes, the food analogy, it's nicer to eat with somebody than eat alone. And I think that is, and sometimes, I think you can it's just one other way. And maybe the guilt's in somebody else, in your own head. And I agree. It is about having the conversation and not letting it get to a point where all that conversation and communication is broken down, because it's much, much harder to get it started again. And a lot of the research says, it's about if you just keep doing it on a regular basis, you'll get better and it increases your enjoyment, even though sometimes it's not what you want to do. But I think for people, look at it as just another way of expressing your care for somebody. And it's not feel guilty that you're not participating, but that you're showing them some care. That'd be.
Just to add to that, I would use 2 words: communication and lubrication. And also what Pauline mentioned in her talk, that there are some specialist physios who, so depending on what the physical act of discomfort actually is, whether there are some really basic, like Catalina's study showed that over 70% of people can feel benefit from a really good lubrication. It's always fun trying different brands and different types. And there are some packs available just on Fish Pond, for example, where you can have samples and sachets for $29 or something, trying 10 different types of lube until you get the one that you like. But if it's not as simple as exploring with new lubrication, it may be worth getting a physical assessment with somebody like a pelvic, specialist who, there's a lot of physios who are specialised in those areas as well. And then I agree with everything that's been said. It's about communicating what's happening for yourself, what you want, and even just rebuilding, putting intercourse off bounds and rebuilding that deep connection through music or touch or massage or just breathing together and being in that intimate zone together as well. So.
And it's also what I said, before, and sometimes is taking it out of, taking the pressure off yourself, and it might be, being passionate and kissing in the park or whatever, and then you still maintain that intimacy, but you're not necessarily feeling pressured to continue or to that performance or that full act. And I think that, holding hands, I'm a big proponent of holding hands and kissing, but I do know that, having a mind-blowing orgasm and really good sex is also really important, and we should never minimise that.
Even for a toasted cheese sandwich.
Statements that are quite.
I make a really good toasted cheese sandwich.
You must. So before we move to the last question, and we've put that question in there because we have had a lot of health professionals register for the webinar, whether they're listening now or not, I'm not sure. But we did also have quite a few questions which I'd love to hear Catalina and Amanda maybe mention, where people were bringing up when they're going into a new relationship, when do they bring up the issues regarding they've had cancer and there could be a few issues with having sex. So it's like, when should I bring it up and how should I bring it up, and kind of like the health professional one, when and how do I do that?
And can I just say that I've been in workshops where I've been surrounded by 40 people who are single and they're looking to pursue new relationships with new partners, and every person in the room had a different response to that very question. And so it comes back to feeling good about yourself, and without feeling that self-respect and the appreciation for your body and mind, that it's very hard to then attract or to engage in an intimate level with somebody else. So I'll be fascinated to hear what you say, but I used to think there was going to be a great answer to that question, and my answer is that it's unique to every person, and the stronger and more positive and confident that you feel in your ability to feel sensual, to be able to express joy, respect, trust, all those things that are really vital in relationships, the stronger or the more possible it is for you to know the right time to bring that up would be.
Well, I can't even agree more as far as how individualized, how we talk, how we express our sexuality, and how we just definitely bring up some of these sexual concerns. And we certainly address how to do this in Rekindle. And we've had some survivors where you're saying, Amanda, as far as some people come out and they just say it on the first date. Look, like, we have one survivor in Rekindle who, she's there with her partner and she's saying, yep, I remember the time I told him on my first date and I think I put his hand on my boob or something like that. So people are very individual as far as what you want to share, but I think the biggest thing, and I think I responded on the chat about this, is figuring that out for yourself first, and taking the time to really honestly use this as an opportunity to take that time to explore yourself and what you feel comfortable with, whether or not that is talking about sex a certain way, expressing your sexuality a certain way, but really using this as an opportunity to kind of heighten your awareness about how you want to do that. And then flat out, this is such a personal decision, and figuring out what you want to say, how you want to say it. You do not need to share your whole story, your whole treatment and everything. You can really, and if for instance, fertility, thinking about those types of issues, you really got to think about what you want to share and who you want to share that with. When you make those decisions, practice it out. Practice it with yourself, practice it with a friend, and actually start developing your own language around this. And that's a lot of when we're doing communication skills training. A lot of it is practice, and your language is how you've changed as a person anyways. You know, it's not at all surprising that how we communicate and how we express ourselves changes as well. So practice it up, but really make that decision on for yourself, and use this as an opportunity to really take that time.
Can I just say that practicing in front of a mirror in the bathroom is a great way. You can shut the door, you can practice, you can try different techniques and get it, and exactly like Catalina said, feeling more confident then with what's going to come out of your mouth at the time that you decide.
Yeah, exactly. So let's move on to the last.
I mean, I sort of sometimes wear two hats, because I've worked in cancer support as well. But I think Helen, you're right, that the language you use is really important, because the language you use to express it is the language you're giving your new partner permission to use as well. And I think there's a challenge. If you're flippant about it, then you need to be prepared that your partner might be flippant back with you. So you need to be, I think that practicing of what you mirror is maybe what you'll get back. And if that's not what you want, then to be really clear about how you want it to come back at you.
Yeah. So
the health professionals there, that was the last question there. A lot of my own research was about trying to get the timing right for health professionals, and I can't implore enough for health professionals just to be able to open the topic and validate that it's okay to ask about sexuality. It's not superficial, it is just as important, because as one remarkable man said to me, I don't want to just be biologically alive, I want to deeply connect with those who are important to me and in my life intimately and sexually. And so as a health professional, I say our responsibility is to raise the topic, recognise when you need to refer on, and also practice, just like we're saying for, as a consumer, as a person affected by cancer, you're practicing raising it with partners or health professionals, and we as health professionals need to practice making it okay, safe, and to be able to then connect on an honest, trustworthy sort of level.
I have an idea just in terms of health professionals, particularly about things like vaginal moisturisers and lubricants and all those sorts of things. I know when I was, my second time, I got given a My Journey kit, which is a fabulous kit, and it comes with a bra and all the stuff that you do and don't need. But maybe, and when I was having chemo, my oncologist gave me a whole list of my medical regime and the side effects and everything like that. And maybe a little kit bag when you get, particularly if you're given an AI, an aroma, an inhibitor, what do you call them? One of those things that dries your vagina up, that you should, maybe a bag with a couple of different things, so that you don't have to go into the chemist the first time to look for that Replens packet, so that you've maybe got something to take home and go, okay, this is maybe what will help for me, so I don't have to be confronted with going into the supermarket or into the chemist and asking for it. I'm a really upfront person. I found that really hard to do. So I think a little kit with a bit more explained, and maybe a Rekindle postcard, but just a little kit bag that makes it, so that's a good way to start the conversation. And this is what's going to happen. And I think that might make it a little bit easier. Certainly, it's just something to throw out to whoever's listening, a health professional, whether it's oncologist there or whatever. But I think that might help.
No, definitely, Pauline. And actually, when we are in our recruitment with Rekindle, we're actually trying to also develop part of Rekindle for health professionals, to teach them how they can actually either use Rekindle or start up these conversations. And so we're trying to do a little bit more work in that to really just open the dialogue.
Can I say that a lot of the nurses, there's fantastic nurses on the end of the cancer helplines across Australia, and many of them have had experienced training in basic, validating that it's okay, raising the topic, suggesting the differences between lubrications and estrogens and erectile pumps and pellets and vacuum devices. So there are a lot of resources around. There's also a fantastic, availability, resource opportunity once a fortnight, where it's a psychosexual medical expert to actually talk to men and women, that's available for free on the helpline, and it's booking into that as well. So there is a lot of practical stuff available. We used to send out lubrication samples from the Victorian Cancer Council helpline. So yeah, there's lots of opportunities, and it's about just opening the possibility of exploring some of those and finding out what's right.
Thanks, Amanda.
Definitely.
We'll move on. We've got a little summary, again, as just to reiterate about opening that conversation and the communication. Your mind is your greatest erogenous zone, which has been mentioned again and again, and discover what you want, and it's okay to ask for it. Adapting to a changed body and mind takes time and practice, and the support out there, you just need to act. So you just need to get out and ask. So we've got some resources here, and as we said, these slides will all be sent to you. So as we have to move away shortly, so the links are there. We've got books, they're all online, and then from Canteen, there's a book there that I think Amanda was involved with, maybe later, baby. And then we've got there the Rekindle, the link to the Rekindle study resource, and of course Cancer Council information and support. And again, Lifeline if you feel you need to ring and speak to somebody tonight. So I'd like to thank you. Sorry we've gone over time, but that's it from us tonight. And I hope you've enjoyed the webinar, and we will be sending the recording to you, plus it will be uploaded to our website. So unless anyone else has got last thing to say, we'll sign off and say good night.
Thanks so much for organizing. It's been great.
Thanks, Jill. It was great. Thank you. Thanks for the opportunity.
And thank you for everyone that's logged on. It's been great having you there, and I hope you watch the webinar again, and I hope you all get onto Rekindle and get some great information and support there. Thank you, everyone.
Take care.